I chose to do my case review on case number 16, which focuses on schizophrenia and the case of Sonny Ford, a 21-year-old male that was admitted to a private psychiatric hospital due to his worsening psychotic symptoms. Schizophrenia is a chronic psychotic disorder that is characterized by disturbances in thinking, perception, emotions, and behavior. According to DSM-5 criteria described in Psychopathology, an integrated approach to mental disorders by Barlow and colleagues from 2023, diagnosis requires at least two core symptoms like delusions, hallucinations, disorganized speech, grossly disorganized behavior, or negative symptoms that are present for at least 1 month, with continuous signs of disturbance needing to last for at least 6 months. Sonny presented with persecutory delusions, believing that the police and the FBI were after him, delusions of reference, thinking that TV messages were directed specifically at him, and auditory hallucinations, restricted affect, and social withdrawal. He also had occupational impairment, and his symptoms escalated after his marijuana use, though the persistence and the severity of symptoms certainly exceeded substance abuse psychosis. 74 did meet the criteria for schizophrenia according to DSM-5. Barlow and others in 2023 emphasized that schizophrenia is a multifactorial brain disorder involving strong genetic vulnerability, dopamine dysregulation, and structural brain abnormalities. Goff and colleagues 2020 explained that schizophrenia involves disruptions in dopaminergic and glutamatergic systems that requires long-term integrated treatment approaches. So to go over kind of the treatment overview in Sonny's case is Sonny's treatment included antipsychotic medication and psychosocial interventions. He was initially prescribed neuroleptics, but he developed extrapyramidal symptoms and was later transitioned to clozapine, which did a lot to significantly reduce the positive symptoms and minimized motor side effects. Goff and others 2020 confirmed that clozapine remains the most effective treatment for treatment-resistant schizophrenia and helps to reduce suicide risk, though it still requires very careful monitoring. Sonny's psychosocial interventions included social skills training, family therapy, psychoeducation, and relapse prevention strategies. Owens and others from 2016 also highlighted that long-term outcomes improve when pharmacological treatment is combined with a structured psychosocial support system. So to jump into the thinking critically questions from the Casebook, question one is basically how important are familial and social factors in the development and maintenance of schizophrenia, and is schizophrenia mainly a biological disorder? So schizophrenia is influenced strongly by biological vulnerability, but that doesn't mean that it's purely biological. Barlow and others in 2023 described schizophrenia using an integrative model, emphasizing genetic liability combined with environmental stressors. And an interesting aspect is that twin studies have showed significantly higher concordance rates among monozygotic twins compared to dizygotic twins, but the concordance is still far from 100%, meaning that we can't just use genetics alone to explain schizophrenia as a disorder. In Sonny's case, he was adopted, so his genetic history is a bit of an unknown, but his symptoms did worsen during major stressors, particularly with his marijuana use, college transitions, and some social strain that he was experiencing. This aligns well with the diathesis stress model that we've covered in the past weeks, which suggests that stress activates the underlying vulnerability. Familial factors definitely play a major role in maintenance and relapse. Research on expressed emotions shows that high levels of criticism, hostility, or emotional over-involvement in family significantly increase relapse risk, according to Barlow and others, 2023. Sonny's relationship with his mother, whom he definitely perceived as critical and invalidating, may have done a lot to contribute to his emotional distress and symptom escalation. An important note here is that family communication patterns don't just cause schizophrenia, but they can certainly influence the course and the severity of a disorder. Owens and colleagues in 2010 found that long-term outcomes are better when individuals with schizophrenia have stable social environments and sustained treatment engagement. So schizophrenia is best described as biologically rooted disorder, but is very much shaped in its course by psychosocial variables. The next thinking critically question from our casebook is basically why do some studies suggest that the long-term course of schizophrenia may be more favorable than once believed? And historically, schizophrenia was viewed as inevitably deteriorating, as in it would just get worse no matter what you did. It was inevitable, you couldn't avoid it. However, there is current research to challenge this assumption. Barlow and others in 2023 report that although many individuals experience chronic symptoms, a significant portion do show meaningful improvement over time. Some longitudinal studies have found that older adults with schizophrenia display fewer positive symptoms like hallucinations and delusions. And Owens and others in 2010 examined the long-term outcomes and found that a substantial number of individuals do achieve partial or even full functional recovery, especially when their treatment adherence is maintained. So factors associated with better outcomes include later age of onset, strong family support, consistent medication adherence, access to psychosocial interventions, and lower premorbid impairment. In Sonny's case, although he did experience very severe psychotic symptoms, he responded moderately well to clozapine and psychosocial interventions. So over time, his hallucinations and delusions decreased significantly, and he was able to return to employment and social functioning. This suggests that schizophrenia doesn't just follow that progressive deterioration model as it was once assumed, but instead the course is variable, and with comprehensive treatments, many individuals can certainly improve considerably. Question 3 in this case is, can psychotic symptoms emerge abruptly, or are they usually preceded by warning signs? And in Sonny's presentation, his acute psychotic symptoms did certainly appear dramatic, and he had persecutory delusions, delusions of reference, auditory hallucinations. But when reviewing his history, we can see that there's evidence of a prodromal phase. Barlow and others in 2023 described the prodromal phase as including social withdrawal, declining occupational functioning, anxiety, suspiciousness, and subtle cognitive changes. Sonny demonstrated many of these symptoms before his full psychotic break. He struggled socially through a childhood, experiencing academic difficulties in college. He became increasingly isolated and developed obsessive thinking patterns before the onset of his persistent delusions. So while psychosis might appear sudden, and in some cases it certainly can be, it's often preceded by months or even years of some more subtle warning signs, but under certain conditions like substance abuse, severe stress, medication noncompliance, etc., those symptoms can escalate very rapidly. Cannabis use is especially relevant in this case, and as Barlow and others in 2023 note, marijuana use has been associated with the earlier onset and increased risk in vulnerable individuals for schizophrenia. Goff and others, 2020, also discussed how substance abuse can really exacerbate psychotic symptoms and complicate the treatment of schizophrenia. So while psychosis can definitely feel very abrupt in many cases, it's usually the combination of progressive vulnerability combined with the triggering stressors. So the fourth and final question from the end of this case is the insanity plea justified for individuals with schizophrenia, such as in the case of John Hinckley? And there's a lot of ethical considerations for this question, and it's really a topic that could be dived into on its own for just a very long lecture and has been the center of many debates. But schizophrenia certainly, it does profoundly impair reality testing. So if a person commits a crime experiencing severe delusions that prevent them from understanding the nature or the wrongfulness of their actions, the insanity defense may be legally justified. But it is important to emphasize that most individuals with schizophrenia, they aren't violent. And as Barlow and others in 2023, they really did a great deal to stress that violence risk increases primarily once psychosis is untreated and when substance abuse is present. It doesn't just come with the disorder of schizophrenia. Goff and his colleagues in 2020 also noticed that adherence to antipsychotic treatment significantly reduces the risk of these more severe behavioral disturbances. So, in evaluating the criminal responsibility aspect, the key issue isn't just a diagnosis, it's more whether the individual can distinguish right from wrong at the time of their offense. To be convicted of a crime, as many of us may know, it requires two aspects, and that's the physical act of the crime, and that's the mental state at the time. So there are some exceptions, obviously, but most crimes look at the mental state of an individual at the time that they commit their crime, and to say that they were under great duress or in some form of psychosis often means that their crime is charged differently, or if it's charged at all. So while schizophrenia doesn't automatically excuse criminal behavior, in cases of severe psychotic impairment, an insanity can be ethically and legally appropriate. And in some cases, it can work, as this disorder does certainly affect an individual's state of mind at certain times. And what I found most engaging about Sonny Ford's case was how clearly it illustrated the integrated model of schizophrenia. This presentation demonstrated the interaction of biological vulnerability and his environmental stress, his substance abuse and family dynamics in a very interesting way to me. I was especially struck by how dramatically his symptoms improved. After he received the appropriate medication, specifically the clozapine, which combined with his structured psychosocial interventions, really reinforced the textbook emphasis that schizophrenia requires comprehensive treatment, not just medication alone, as outlined by Barlow and colleagues 2023. Maybe most importantly is this case challenges the outdated assumption that schizophrenia inevitably leads to lifelong deterioration, as supported by Owens and colleagues in 2010. Meaningful recovery is possible for many individuals with sustained treatment and sustained support combined. So Sonny's case really demonstrates that schizophrenia is certainly very serious and very complex, but oftentimes with integrated care, stability, and improved functioning are realistic, attainable outcomes.